A man came to the clinic because he was waking up several times at night to urinate. I mean, he thought it was just a part of getting older. He wasn't in severe pain. He wasn't particularly worried about his symptoms. He almost didn't mention it to me, but that conversation changed his life. The difficult truth is that many men ignore symptoms because they're busy, they're embarrassed, or simply assume it's part of normal aging. Yet, prostate cancer is one of the most common cancers affecting men. In fact, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. And here is what many people don't realize. Early prostate cancer often causes no symptoms at all. So in these videos today, I'm going to explain the warning signs, who is at risk, and the conversation every man over 40 should consider having about their prostate health. Hello, I'm Dr. Hadi, a family physician based in Canada with experience in both emergency and family medicine. My mission is simple: to help you understand your health and recognize symptoms that deserve attention before it's too late. Why should you care? Here's a question for you. If your car started making noises, will you ignore it? Most of us wouldn't. Yes, many men ignore changes in their own bodies for months, even for years. Prostate cancer is often very treatable when detected early. That's why awareness matters. So let's talk about the prostate. What is the prostate? The prostate is a small gland located just below the bladder in men. It surrounds the tube, or you could call it the channel that carries urine out of the body. So as men get older, naturally the prostate can enlarge. It can also get inflamed, or it can also develop cancer. By the way, how old are you? Let me know in the comments below. And if you know a father, husband, brother, uncle, or friends who needs this information, please share this video to them. So let's talk about the risk factors. Who is at higher risk of developing prostate cancer? 1, age over 50, family history, African or Caribbean ancestry, or certain inherited genetic conditions. Don't get me wrong. Having these risk factors doesn't mean you will develop prostate cancer. It only means you may benefit from having an informed discussion with your healthcare provider. So below are the symptoms that men should not ignore. 1, if you experience difficulty starting urination. 2, if you develop weak urine stream, which means the pressure of your urine is low. Frequent urination, especially at night. Now, a very quick question here is, how many times do you wake up at night to urinate? Now, these are other symptoms to watch out for. Feeling that the bladder is not empty. If you notice blood in the urine, or blood in your semen, or if you experience persistent pain in the hips, back, or your pelvic area. And lastly, unexplained weight loss or feeling fatigue. Now, it's important to know that these symptoms do not automatically mean cancer. Many men with these symptoms have other conditions such as an enlarged prostate. However, persistent symptoms deserve medical evaluation. Now, remember what I said at the beginning. Here's the surprising part. Early prostate cancer may cause absolutely no symptoms. None. Yes, you heard me right. That's why waiting until you feel unwell is not always the best approach. Do not wait until you develop symptoms. This is where conversations about screening becomes very important. Essential. Now, the screening may involve a lot of things. It could include a PSA blood test, where a blood sample is taken to check for certain things in your blood called PSA. Sometimes a digital rectal examination is done by the doctor, where to check the size of your prostate. So screening is not just one size fits all. The decision about whether and when to screen should be individualized after discussing the potential benefits and limitations with your healthcare provider. No one can completely prevent prostate cancer, but the following healthy habits can support overall health. 1. Maintain a healthy weight. Exercise regularly. Eat a balanced diet. Avoid smoking. Keep up with regular medical care. You see, most men spend more time servicing their cars than checking their health. Your prostate doesn't deserve or doesn't need your fear. It needs your attention. Don't ignore persistent symptoms. Don't just assume everything is simply part of getting older. And don't wait until something becomes serious before starting the conversation with your healthcare provider. If this video helps even one man seek care earlier, then making it was truly worth it. If you found this video helpful, please like it, subscribe to the channel, and share with someone you care about. Because the information you share today could genuinely change someone's future.